Assalamu alaikum dear students. Today our topic is muscles of facial expression. We will study the names of the various muscles of facial expression. We will study their origin, insertion, nerve supply and actions. The muscles of facial expressions, they are called muscles of facial expressions because they bring about various expressions on the face. Most of them arise from the bones of the skull and are inserted into the skin. Morphologically, they represent the specialized members of subcutaneous muscles of the lower animals. Embryologically, they develop from the mesoderm of the second pharyngeal arch, and hence they are supplied by the facial nerve, which is the nerve of the second arch. Functionally, they perform the closing and opening of the orifices in the region of the face, and they also perform the important function of non-verbal communication. Muscles of the facial expressions are grouped as under the orbital group, the nasal group, the oral group, the articular group, and other muscles. Among the other muscle, one is muscles of the scalp, the frontalis muscle, and some people also include platysma. Although platysma is a subcutaneous muscle of the neck, but they include platysma in the muscles of facial expression because it is supplied by the facial nerve. Now we will study these groups one by one. First we will study the orbital group. We will start with the orbital group. The orbital group has two muscles, the orbicularis oculi and the corrugator supercilii. These two muscles, the orbicularis oculi and the corrugator supercilii. The orbicularis oculi has two parts. This one is the palpable part in the eyelid, the palpable part of the orbicularis oculi, and this one is the orbital part of orbicularis oculi around the orbital margins. The palpable part of the orbicularis oculi arises from the medial palpable ligament and goes laterally, and the fibers are inserted into the lateral raphe. The orbital part of the orbicularis oculi arises from the medial palpable ligament, the nasal part of the frontal bone, the frontal process of the maxilla, and these fibers form concentric circles and they reach their point of origin and are inserted there. They form an uninterrupted ellipse and come back to their point of origin where they are inserted. The function of the palpable part of the orbicularis oculi is that it closes the eyes gently, and the function of the orbital part of the orbicularis oculi is that it closes the eyelids forcefully. The palpable part closing the eyelids gently, and the orbital part closing the eyelids forcefully. Now the other muscle, the corrugator supercilii, it arises from the medial end of the superciliary arch and is inserted into the skin of the medial half of the eyebrow. It is inserted into the medial half of the eyebrow. The function of the corrugator supercilii is that it draws the eyebrows medially and downward. They draw the eyebrows are present here because it is inserted into the skin of the eyebrow, so they draw the eyebrows medially and downwards. So this is the function of the corrugator supercilii. The orbicularis oculi and the corrugator supercilii, both these muscles are innervated by the facial nerve. So we have done the orbital group. Now will we move to the next group. Now we will start the nasal group. The nasal group has three muscles. The procerus, this muscle, this is the procerus muscle. The other is nasalis muscle. The nasalis muscle has two parts, the transverse part and the alar part. The transverse part is this one. This is the transverse part, and this is the alar part. So nasalis has two parts, the transverse part and the alar part. This transverse part arises from the maxilla just lateral to the nose, and its fibers form aponeurosis which crosses the dorsum of the nose and meet with the aponeurosis of muscle of the other side. This transverse part of the nasalis is supplied by the facial nerve, and its function is that it compresses the nasal aperture. The other part is the alar part, this one, the alar part. The alar part arises from the maxilla over the lateral incisor. There is the lateral incisor here, and just above the lateral incisor, the alar part of the nasalis arises, and it is inserted into the alar cartilage of the nose. This is the alar cartilage of the nose below the skin. The nose is formed by the alar cartilage and the lateral cartilages. Here is the lateral nasal cartilage, and this is the alar cartilage of the nose. So the alar part arises from the maxilla over the lateral incisor and is inserted into the alar cartilage of the nose. This is alar part is supplied by the facial nerve, and its function is that it draws the cartilage, this alar cartilage, downward and laterally, opening the nostril. It draws the alar cartilage downward and laterally, and hence opens the nostril. Coming to the other muscle, the procerus, this muscle. This is the procerus muscle. The procerus muscle arises from the nasal bone here, and from the upper part of, this is the lateral nasal cartilage, from the upper part of the lateral nasal cartilage. The procerus arises from the nasal bone and the upper part of the lateral nasal cartilage. This is the procerus muscle, and it is inserted into the skin of the lower forehead between the eyebrows. It is inserted into the skin of the lower part of the forehead between the eyebrows. It is also supplied by the facial nerve, and the function of the procerus is that it draws down the medial angle of the eyebrows. Okay? They draws down the medial angle of the eyebrows. Here are present the eyebrows, and they draws down the medial angle of the eyebrows. And thus it produces a transverse wrinkle on the bridge of the nose. On the bridge of the nose they produce transverse wrinkles. The last one is the depressor septi nasi. This one, the small portion is visible here. This is the orbicularis oculi. We are not talking about this. This is the depressor septi nasi. It arises from the maxilla above the medial incisor. That was lateral incisor, and that is the above the medial incisor, and it is inserted into the septum of the nose, the nasal septum. The mobile part of the nasal septum is attached to this part. The depressor septi nasi is also supplied by the facial nerve, and it pulls the nose inferiorly. It is depressing the septum of the nose, so pulling the nose inferiorly. Thus, we have studied the fursalis, the nasalis, which has transverse part, alar part, and the depressor septi nasi. With this, we finish the nasal group of muscles. Now we will move on to the next group of muscles. Now we will start the oral group. The oral group has many muscles. First we will study these four muscles. The depressor anguli oris. This is the depressor anguli oris, and then the depressor labii inferioris, then the mentalis muscle, and the rhizorius muscle. This is the rhizorius muscle. The depressor anguli oris arises from the oblique line of the mandible below the canine, premolar, and first molar tooth. Its fibers go upward and are inserted into the skin at the corner of the mouth, and its fibers blends with the fibers of the orbicularis oculi. This is orbicularis oculi, and the fibers of the depressor anguli oris blends with the fibers of the orbicularis oculi. The depressor anguli oris is supplied by the facial nerve, and its function is that it draws the corner of the mouth downward and laterally. This is the corner of the mouth, and it draws the corner of the mouth downward and laterally. The other muscle, depressor labii inferioris, this also arises from the oblique line of the mandible. It is from the anterior part of the oblique line of the mandible, and its fibers go upward and are inserted into the lower lip at the midline, and its fibers blend with the fibers of the muscle of the opposite side. This depressor labii inferioris is supplied by the facial nerve. It is supplied by the facial nerve. The function of the depressor labii inferioris is that it draws the lower lip downward and laterally. Then comes the mentalis muscle. This is the mentalis muscle. It arises from the mandible inferior to the incisor teeth. Its fibers are then inserted into the skin of the chin. The fiber arises from the mandible inferior to the incisor teeth and inserted into the skin of the chin. The mentalis muscle is also supplied by the facial nerve, and its function is that it produces the lower lip, and it produces wrinkles on the skin of the chin. Then the rhizorius muscle. The rhizorius muscle arises from the fascia or the masseter muscle. Here is present the masseter muscle, and the rhizorius muscle arises from the fascia or the masseter muscle, and it is inserted into skin at the corner of the mouth. Here at the corner of the mouth it is inserted into the skin. The rhizorius muscle arising from the fascia or the masseter muscle and inserted into the skin at the corner of the mouth. This is also supplied by the facial nerve, and its function is that it retracts the corner of the mouth. It retracts the corner of the mouth. We will continue with the oral group. This is the zygomaticus major muscle. The zygomaticus major muscle, it arises from the posterior part of the lateral surface of the zygomatic bone. The zygomaticus major muscle arises from the posterior part of the lateral surface of the zygomatic bone, and it is inserted into the skin at the corner of the mouth. Inserted into the skin at the corner of the mouth. This muscle is supplied by the facial nerve, and its function is that it draws the corner of the mouth upward and laterally. The next muscle is the zygomaticus minor muscle. This is the zygomaticus minor muscle. It arises from the anterior part of the lateral surface of the zygomatic bone and is inserted into the upper lip. Just medial to the angle of the mouth. This zygomaticus minor muscle is also supplied by the facial nerve, and its function is that it draws the upper lip upward. Next muscle is the levator labii superioris muscle. This is the levator labii superioris muscle. It arises from the infraorbital margin of the maxilla, and it is inserted into the skin of the upper lateral half of the upper lip. This levator labii superioris is also supplied by the facial nerve. Its function is that it raises the upper lip and it helps in the formation of nasolabial furrow. Between the nose and the upper lip there is a furrow, there is a fold that is called the nasolabial furrow. So the levator labii superioris raises the upper lip and help in the formation of nasolabial furrow. Next muscle is levator labii superioris alternati. This muscle, the superior levator labii superioris alternati, this muscle arises from the frontal process of the maxilla and is inserted into the alar cartilage of the nose and the upper lip. This is supplied by the facial nerve, and it raises the upper lip and opens the nostril. Then is the levator anguli oris. The levator anguli oris, this one, the levator anguli oris. The levator anguli oris arises from the maxilla below the infraorbital foramina. And it is inserted into the skin at the corner of the mouth. It is supplied by the facial nerve, and it raises the corner of the mouth and help in the formation of nasolabial furrow on this side. It raises the angle of the mouth and helps in the formation of nasolabial furrow. Then come the vaccinator muscle. The vaccinator muscle we will discuss in the next slide. Here we will discuss the orbicularis oris muscle. The orbicularis oris muscle arises from the muscles in this area, and from the maxilla and the mandible in the midline. The fiber form an ellipse around the mouth, The fiber form an ellipse around the mouth. It is supplied by the facial nerve, and the function of the orbicularis oris is that it closes the lips and protrudes the lips. With this, we finish the oral group of the facial muscles, the muscles of facial expression. The last muscle which was left from the oral group is the vaccinator muscle. This is the vaccinator muscle. The vaccinator muscle arises from the posterior part of the maxilla and the mandible and the pterygomandibular raphe. The posterior part of the maxilla and mandible and the pterygomandibular raphe. Its fibers blends with the fibers of the orbicularis oris into the lips. This muscle, the vaccinator muscle, is supplied by the facial nerve, and its function is that it presses the cheek against the teeth, and it also compresses the distended cheeks. Next, we will study the articular group. It has three muscles: the anterior auricular muscle, the superior auricular muscle, and the posterior auricular muscle. This is the anterior auricular muscle. It arises from the anterior part of the temporal fascia and is inserted into the helix of the ear. The anterior auricular muscle arises from the anterior part of the temporal fascia and is inserted into the helix of the ear. The function of the anterior auricular muscle is that it draws the ear upward and forward, and it is supplied by the facial nerve. The other muscle, this muscle is the superior auricular muscle. The superior auricular muscle arises from the epicranial epineurosis and is inserted into the upper part of the auricle. This superior auricular muscle is supplied by the facial nerve, and its function is that it elevates the ear. The other muscle is the posterior auricular muscle. It is present on the posterior aspect of the ear, and it arises from the mastoid process of the temporal bone and is inserted into the convexity of the concha of the ear. It is supplied by the facial nerve, and its function is that it draws the ear upward and backwards. Now the muscle of the scalp, the occipitofrontalis muscle. This is the occipitofrontalis muscle. This is the frontal belly, and this is the occipital belly. Some people call this as a separate frontalis muscle and this is the occipitalis muscle, but collectively they are called as occipitofrontalis muscle. The frontal belly of the occipitofrontalis muscle arises from the skin of the eyebrows and is inserted into the galea epineurotica. This frontal belly of the occipitofrontalis muscle is supplied by the facial nerve, and it raises the eyebrow and makes wrinkles in the forehead. The posterior belly of the occipitofrontalis muscle arises from the lateral part of the superior nuchal lines and the mastoid process of the temporal bone, and they are inserted into the galea epineurotica. This posterior belly of the occipitofrontalis muscle is also supplied by the facial nerve, and it draws the scalp backwards. So this is the occipitofrontalis muscle. The clinical testing of the muscles of facial expression. The muscles of facial expression are supplied by the facial nerve, and we know that the facial nerve is the most commonly involved nerve in various pathologies. Due to pathologies of the facial nerve, these muscles also suffer. So we can clinically test these muscles by the following ways. We can test the frontalis muscle by asking the patient to look upward without moving his head, and then we look for the horizontal wrinkles on his forehead. If the horizontal wrinkles are present, it means that the frontalis muscle is intact. To test the corrugator supercilii, we ask the patient to frown and then look for the vertical wrinkles between the two eyebrows. If these vertical wrinkles are present, it means that the corrugator supercilii is intact. To test the orbicularis oculi, we ask the patient to close his eyes tightly. If he can close his eyes tightly, it means that the orbicularis oculi is intact. For orbicularis oris, we ask the patient to whistle. If he can whistle, it means the orbicularis oris is intact. For the dilators of the mouth, we ask the patient to show his teeth. If he can show his teeth, it means the dilators of the mouth are intact. To test the vaccinator muscle, we ask the patient to puff his mouth and then blow out the air forcefully. If he can do this, then the vaccinator muscle is intact. To test the zygomaticus major muscle, we ask the patient to laugh. And then the rhizorius muscle. To test the rhizorius muscle, we ask the patient to smile gently. If he can smile gently, it means that his rhizorius muscle is intact, and if he can laugh, it means that the zygomaticus major muscle is also intact.